Welcome to another episode of Chat GRC on the Blue-Lusional podcast, where myself, Devin, and Casey interview a new grassroots candidate every single week. We have a celebrity amongst the grassroots candidate world. This week, I am very excited, if you can tell how hard I'm cheesing right now. Also, I'd be remiss if I didn't say Happy May the 4th. May the 4th be with you. Young lady, please introduce yourself, what you're running for. Why are you talking to us today?
I love that you said it was May the 4th because behind me, you can't see it. I have a framed tweet from Mark Hamill. He tweeted about me to me once a couple years ago, and I printed it and framed it. So May the 4th be with you as well.
I also would frame a Mark Hamill tweet if he tweeted about it.
Who wouldn't?
Immediately.
Come on. It's a big moment for me. Well, I'm so happy to be here. I am Dr. Annie Andrews. I am a mom and a pediatrician and a Democratic candidate for the U.S. Senate here in South Carolina, working to end the decades-long career of Lindsey Graham.
Thank God.
South Carolinians, you better understand this assignment. My God.
Yeah. He's recently making it much easier for you. Before.
Isn't that the truth? Yes.
Yes. Well, when we were doing our research, I was very excited because not a lot of candidates that we get on here have run before. Most of them, this is their first time ever running. So I do love speaking to candidates that have run before, because my first question would be, what inspired you to run for Senate? But this is not your first time running. So what inspired you to run again and to run this time for Senate? Because last time you ran just for Congress, for House of Representatives.
That's right. That's right. I ran against Nancy Mace in South Carolina's 1st district, and we put up a really good fight, but we did not win in 2022. That was not a year Democrats were going to swing big to the left. That just wasn't going to happen. But I learned so much from running the first time. After that race, I did not think I would run again. I certainly did not think I'd be running against someone as deeply entrenched as Lindsey Graham. But, you know, everything that happened after the 2024 election, like the days that followed that election when we were all so heartbroken, I had given everything I had to helping elect Harrison Walz. I was one of the 4 women who organized that Answer the Call, Win with White Women call after the Black women call, you know, when we were having all those Zoom calls raising millions of dollars. The vibes were so good. I was like deeply entrenched in that world and just believed it was going to happen. I had the camo hat. I was in it to win it, and devastated when Trump won again, and then watching who he was nominating on his cabinet, really culminating with the nomination of RFK Jr. to lead HHS. I realized that now's the time. Like, it doesn't make sense objectively for me to be running for statewide federal office right now. I have 3 kids who are 14, 11, and 9. My life is incredibly busy and full already, but I recognize that, like, it's now or never. Everything is on the line, and we've got to do everything we can. And as someone who had run for office before, as someone who knows that I can raise money, that I can communicate effectively on social media and earned media and all of that, like, we need a strong candidate in this race. So I raised my hand, and here we are.
Thank God.
Yeah. Because in 2020,
to the point about
you were close. You were pretty close. You were like, it was like 42 to 50. It came down close for 2022.
Thank you for that. It came down to partisan lines, and you know, that was the election cycle that Roe fell. So it was really important for me as a woman and a doctor and a mom to be on the ballot, to give voice to the women in that district. I was able, because at the end of the day, like, it wasn't a race that we were going to win. I was able to run ads on the issues I care about. We talked a lot about gun violence prevention. We talked a lot about reproductive healthcare freedom. And it made a difference. And it really kind of started a movement here in South Carolina. And that movement has carried over into this campaign that I'm running right now.
Yeah.
You got that name recognition.
Yeah.
I did want to bring up, though, with the appointments, though, like how RFK, what really was setting me off during that whole time was that that Democrats were signing off on confirming them. And I was tracking it. I have a spreadsheet. And I was like, oh, no, we have to absolutely clean the house entirely, because what do you mean that you're affirming these people? Why? They don't need your help. They're going to get affirmed either way.
Yes. So. Yes. And I mean, when RFK Jr. was nominated, I knew ultimately he would be confirmed. I was most disappointed in Bill Cassidy, the senator from Louisiana, because he is a physician and he knew better and he knows better. And I hope that that man has not had a peaceful night's sleep since the day he voted to confirm RFK Jr.
A mistake, a whole mistake.
Yes.
Well, I need you to put on the teacher hat instead of the doctor hat for a minute. So this is educational. Nobody knows how anything works. We're only figuring stuff out now since it's getting ripped apart in front of our very eyes. So tell the people, what does a senator do and how can they use that influence on the local level?
Can I call in my 8th grade daughter to come in here and talk about what it does?
It might come down to that.
I guarantee she knows more than the average voter because they're learning
Probably.
about
Probably.
Yeah. I mean, a senator, I'll be one of 100 U.S. senators. Every state has 2 senators. And unfortunately, South Carolina is wasting a whole U.S. Senate seat on a human being who doesn't think about South Carolina ever. And so, each state gets 2 senators, and the senators are part of the legislative branch, and they help to write laws and they vote on legislation. Historically, they have been considered the more serious deliberative body in the legislative branch of government because the terms are 6 years. So you think the day-to-day politics won't affect the way they vote because they don't have to run for election every 2 years like our members of the U.S. House do. But of course, in today's government, they are not a serious deliberative body. And they have just become so dysfunctional in part because of the filibuster, in part because of the deeply partisan moment we are in. But the filibuster requires 60 votes in the Senate to pass meaningful legislation. And because we're so hyper-partisan right now, to reach that 60-vote threshold, it's nearly impossible. So that's why nothing is getting done in Washington, D.C. So, we need serious problem solvers in the Senate. And that is who I am. I am a doctor by training. I have spent 20 years taking care of sick and injured children. And when I walk into the hospital for my day job, I don't have the luxury of saying, well, this problem seems too hard. I'm not going to solve this problem today. Every sick or injured child in front of me, it's my duty as a physician to do everything I can to solve that child's problems. That is the same approach I will take in the U.S. Senate. And like you said, we just need to clean house because there are very few members of the U.S. Congress right now who go to work with that attitude that we just need to get the job done for the American people. And you're right. You asked about how that affects the local level. Well, I'm here in South Carolina. I'm a Democrat in South Carolina, and I've been very active in my state capital talking to our state representatives and senators. And it's like banging your head on a wall when you try to convince them to care about the issues that people care about, like fully funding our Department of Education here in South Carolina, giving teachers a pay raise, or, fixing our broken roads and crumbling roads and bridges, or fixing our broken healthcare system. And when I talk to lawmakers in South Carolina, I don't get anywhere. And so we need change at the federal level to help protect people in states like South Carolina and to set the tone for where this country needs to go. And it all matters. Local elections matter so much, but a U.S. senator has so much power. And imagine the difference in someone who's bought and paid for, like Lindsey Graham, replacing him with me, a pediatrician and a mom who just wants to get the job done.
Yeah.
Someone who took an oath to do no harm.
Exactly.
Yeah. I mean, people are now realizing very recently with Lindsey Graham, who's going on a world tour to defend Israel right now, that he right now is basically the senator of Israel. He is not the senator of South Carolina. And the only time he seems to care about South Carolina is trying to get everyone to enlist in the army. So that's who you have representing you. To your point, there's a lot of egos right now in the Senate. There's a lot of people who are bought and paid for, and that influences how they vote. And what we have seen with the amount of grassroots candidates we're talking to who are running for Senate, there are so many people coming from all different walks of life, people who have been in the military, people who are nurses, people who are doctors, people who are businessmen. We need people that have seen life from so many different perspectives. Having you who have seen children, who have seen families at their lowest, who have seen people coming from all walks of life. You have to work every single day. You never know what you're going to walk into at the hospital every single day.
That's right.
We need people who are not just politicians, who are actual human beings, care about people in office again.
Yes. And I can't imagine a more community connected job than a pediatrician who works in the
Yep.
local children's hospital or a public school teacher. I think both are probably the most community connected because you understand, like, at an intimate level, the problems that real people in your community are facing when you go to work every day in a children's hospital. You don't have the luxury of working in some fancy high-rise office building, never actually talking to real people. And the US Senate and the US House are full of people who are so disconnected from the problems of everyday Americans. And that's got to change. Like, that's not how the Congress was meant to work. It's meant to not be a lifelong career. It's meant to be something you go and do. You bring your expertise, your professional background, your perspective on life. You do that job for a while, and then you go back to the career that you had before. And I think that's, like, think about Lindsey Graham. He has no career to fall back on. Everything about him is wrapped up in his role as a senator. I want to go up there 2 terms, term limit myself, solve some problems, and then go back to the job that I wanted to do since the age of 4 because I want to be a pediatrician. You talk about all of these helpers who are deciding to run for office, these nurses, these firefighters, everybody. These people would rather do the job that they trained to do. I can tell you, I would rather just be a pediatrician, but I cannot look away from the problems I see every day at the hospital. I consider it, the politics is a path to solve those problems. This is never something I wanted to do. This has nothing to do with my ego. This has to do with fixing the problems that people in Washington, D.C. refuse to fix.
That's been a constant with pretty much everyone we talk to. They're like, I don't want to do this. I want to fix this shit. Get out and have somebody else take over because this is not a good time. We're not having a good time right now.
No, this isn't fun. This isn't convenient. This isn't like an easy path. This is the hardest thing I've ever done aside from birthing my 3 children. And it's not what I had planned. And my life was so much more comfortable when I was just a full-time pediatrician.
Yeah, people seem to forget that. I think people have glamorized politicians because in a lot of senses it looks glamorous. You make all this money, you get to be in Washington D.C., but the reality of the situation is it's not glamorous. It's not supposed to be glamorous. You're not supposed to become a millionaire. You're not supposed to stay in office for the rest of your life, get all these deals, go on all these TV shows. That is not normal. We need to make politics boring.
They're social media influencers at this point.
Right. And like social media is a really important way to connect with voters and to get your message out there. But like, that's not the end of the job. People like Nancy Mace, they think that is the job, getting cable news hits and growing your Twitter following. And that is not the job. That is a way to communicate what you're doing at your job. But they've like lost the thread, and it's got to stop. We just need to elect serious people.
Yes.
Yes.
And this leads perfectly into the next part because we were talking about Lindsey Graham and how he is anywhere but in South Carolina, especially with the amount of recess they've been on. But you are, and you're talking to constituents. We want to know how they are feeling right now. We are more over a year into this administration. So much damage has been done. What are the people in South Carolina telling you? How have they been affected? How are they feeling?
I was talking to 3 senior South Carolinians today about this, and I asked them this very question, and they just are struggling. They're struggling with housing prices and grocery prices and gas prices. And, this one of the women was talking about their Medicare and their Social Security, and it's not making ends meet anymore. And it's just, I'm old enough to remember a time when I didn't wake up every day and think about the federal government. I didn't think about the president of the United States every day. The government, when it's doing its job well, you don't think about it every day. You pay your taxes and you go on about your life. You get your health care, the roads are functioning, your kid's in a good school, the environment is not struggling. And, we've just totally lost the thread. So when I'm talking to voters, they're talking about prices, affordability, because that is the number one issue on everybody's mind. A big piece of affordability, of course, is healthcare. And so here in South Carolina, we have an already broken healthcare system, just like in the entire country, but we never even expanded Medicaid here. So there's already a higher number of South Carolinians who are falling in that uninsured or underinsured crack. And we have overcrowded emergency departments. We have 15 counties now without a single OB/GYN. We have some federally qualified health centers that have already closed their doors because of the impending Medicaid budget cuts that my opponent, Lindsey Graham, voted for in the U.S. Senate. And prescription drug prices that make no sense. They're through the roof, and there's things we could do, but we're not doing them. And so, it's really a matter of affordability and healthcare. But then people are starting to understand how corruption is playing into these two problems. And so when I get huge nods from voters like you two are doing right now, when I start talking about rooting out the corruption that is really degrading American democracy, and we do that through a series of actions, but we do that by passing term limits, banning members of Congress from trading stock, getting dark money out of politics, ending Citizens United, banning members of Congress from becoming lobbyists, all of those things. If we can do those things, we can have a government that works for the people again. And then people don't have to wake up every day and think about what is the government doing to make my life harder today.
Yeah. Like, it's not every day that TMZ is following Lindsey Graham to Walt Disney World while they're on a 2-week recess. That is not normal in any stretch of the means. This is what we've come to. Like you said, we're uncovering corruption. So in our day to day, if they're not at Capitol Hill, everyone wants to know where they are. And they're never home.
Nope.
Never.
They're not, he's not back here talking to voters. I can tell you that much.
And the TMZ thing, and people, they're like, TMZ is doing the Lord's work. And I'm just like, this is not good. This is an entertainment hub. The government is so unserious that they're like, oh, let's just follow these clowns around
for clicks. And it may end up saving our democracy, but we should be deeply embarrassed that we're relying on TMZ to save our democracy.
Yes. And that's why I say, I'm like, at the end of the day, the past 2 months have looked really great for you because for some reason they are just really following Lindsey Graham around. He is, he's on the front lines for Israel right now, and
drunk. That man's been drunk. Like, let's be real, he's been drunk at these podiums. Drunk. Make Iran great
doing
again.
Well, and he's 70 years old. Like, I don't think he probably really wants to be a senator anymore. I think he's being pressured to not give up his seat.
Money.
But I mean, I'd just gladly relieve him of that job title.
Yeah. And he definitely doesn't. He's like full warmonger. I'll just go full warmonger. That's fine. No big deal. Okay. So we're losing rights. We saw the lower court circuit attack women's rights again with the banning of mifepristone. That's currently in flux, though, because the Supreme Court, put a temporary stay on it for about a week. But when you get in, what type of legislation would you put in to protect women's bodily autonomy?
So we basically need to restore Roe. That worked for everybody. I mean, first of all, what I will say is if you cannot pass a pop quiz about women's reproductive anatomy, you should have nothing to do with writing laws about women's reproductive anatomy. And I can guarantee you, Lindsey Graham would fail a pop quiz on women's reproductive anatomy. And so would most men in Washington, D.C. So
most men.
Okay. General. Yes. I said too many words there. You're right. You're right. But, women's rights change based on what state they're in. Men's rights do not change based on what state they're in. And this is just a way to try to control women. Actually, my 8th grader asked me on the way home from dance today, because they're learning about the government. She's like, explain what pro-life means. And I just went off on how pro-life is a misnomer and all of that. But we need federal protections so that women in South Carolina are not arrested for seeking health care, so that doctors in South Carolina are not thrown in jail for providing life-saving, evidence-based health care. And it's just, it's just too much. It's got to stop. And, I've been thinking a lot about, because, I'm trying to win an election here in South Carolina. And as I told you, I was really involved in trying to catalyze and organize white women to support the Harris Walls campaign, because we look at how these constituencies vote. If white women started voting shoulder to shoulder with Black women in the best interest of women writ large, we could swing every election in every state, in every district, everywhere, forever. And, I've been thinking a lot about the SAVE Act and about this Mifepristone decision and how the patriarchy, our proximity as white women to the patriarchy will not protect us. They are coming for all of us. We think we're protected because of our proximity to the patriarchy. That is not true. And white women need to wake up and start voting in our best interest, in our daughters' best interest, because they are coming for us. They are coming for our right to vote. They are coming for our bodily autonomy. And if we do not win in November 2026, I cannot tell you what this country will look like by 2028.
Speak on it. You
Yeah.
hit it.
Sorry.
No notes.
Pointed out something earlier that immediately came to mind to me, and we had put out a video about it with the mifepristone, was that, as you're saying, we already have a broken healthcare system. People are waiting months to see their gynecologist just for routine appointments. People are not able to afford health insurance. Right now, clinics are closing down because of the cuts from the big, beautiful bill, and it's going to get worse. So the gap was already there, and telehealth was ever so slightly filling the gap and allowing you to see someone a little bit sooner. And what this has done is taken that away and still not addressed the bigger problem, which is when you need reproductive care, you don't have months to wait. You don't have weeks to wait. So for you saying we need to fix this, but we also need to fix healthcare in general, because the whole thing is broken. And this, while Project 2025 clearly stated that this is what they plan to do, it doesn't make it any easier to see it actually happen in front of your eyes. So many things need to be addressed. But I do love that, for one, you're saying we need to reinstate Roe v. Wade. This shouldn't even be a discussion anymore. We shouldn't have to. Yeah, it should have never been overturned in the first place. And we need to address that situation. And then we also need to address why women can't see their gynecologist months on end.
Right. And I think, to be really clear about what the Medicaid budget cuts will do, I mean, the degree of budget cuts coming, and as you said, the, air quotes, big, beautiful bill will devastate access to healthcare in states like everywhere, but in states like South Carolina, where we already really struggle to provide healthcare to our most under-resourced communities, to people already living in poverty. And when hospital systems are looking at these impending budget cuts, they're looking at what services they're going to need to cut so that they can meet their bottom line. And I hate to be the bearer of bad news, but the two medical services that bring in the least amount of revenue are pediatric care and maternity care. So when big hospital systems in a state like mine are looking at their rural satellite hospitals and what they can afford to keep open and not keep open, they're going to keep open their cardiac unit. They're going to keep open their orthopedic surgery service. They're going to close their maternity services and their pediatric services. So women now have to cross multiple county lines just to go get a checkup in early pregnancy. And when you're pregnant, time is health. And you need these checkups. You need your blood pressure checked. You need your blood sugar checked. You need fetal scans. And it's just, it's so clear to me. They just don't care about women. As I said, my daughter asked me about pro-life. They're not pro-life. They're pro-birth. They don't give a shit about the baby once it's born. And they don't ever care about the woman.
Literally.
Yeah, figure it out.
Figure it out and then have another one.
That's right.
And make sure that they are ready on their 18th birthday to go work in that factory. Okay.
Or go to war.
Yeah, go to war, one or the other. One or the other. But it's something that needs to be addressed. And I completely agree with you that white women need to wake up, because what happened today was so many white women were like, oh my God. And I had to say, you, in all reality, you lost your rights this week. Black women also lost rights with the Voting Rights Act. So 2 times in 1 week. So you guys everybody needs to wake up. White women absolutely need to wake up and realize that we are not far behind.
It was written down.
It was written.
Yes.
Chronological order. We are next. So it has to be a priority in November. You've already spoken on this a little bit, but wondering if you could dive deeper into what unique perspectives and tools that you would bring to the Senate as somebody who works in healthcare, who is a doctor.
So, it's my actual professional experience of working in healthcare systems and understanding, the barriers patients face to accessing affordable quality healthcare, understanding what a functioning healthcare system needs to look like and how hospitals are struggling to keep their doors open, how over time, the amount of time I spend as a doctor on the phone with our case managers and our social workers and my patients' insurance companies because the system is so overly complicated. That amount of time has grown and grown and grown over my 20-year career, and it's just not sustainable. We need a simpler healthcare system in this country where every patient doesn't have a different private insurance plan that covers different
Mhm.
services differently. And it's all just so, like, I can take that really practical experience from working on the ground in our healthcare system for 20 years, but also what I was talking about before, just like that problem solving approach. Doctors are, we're smart, we're fast learners, and we're problem solvers. And, I use this analogy often because people ask, will I work across the aisle when I get to Washington, D.C.? And I think, you know, this country needs two healthy political parties at least to function effectively. We really need to get back to a time where we have two functioning political parties and where working across the aisle is not considered, like the end of your career.
Mhm.
But as a
Then-
doctor, like I have a patient in front of me who needs a surgical consult. I'm not a surgeon, so sometimes I have to call for help. And I look up on, the call sheet, who's on call for pediatric surgery today, and say it's a surgeon who I think is a jerk, who I don't want to work with. Am I just going to not call them because I don't like this man? Or I'm going to call him because my patient needs him? I'm going to call him because he's going to help me solve the problem in front of me. I'll do the same. When Tim Scott and I are hand in hand as South Carolina's senators, I'll work with him when he's willing to work with me to solve the problems of our constituents. We just got to get the job done. And I think that's what I can bring to the Senate is just that, like, roll up your sleeves and get the job done. These things are hard. These problems are hard. And we need hard workers, serious people who are willing to solve them.
Mhm.
That's a thing too we're arguing with people about because everyone's so pissed off, right?
Mhm.
And they're just like, okay, Republicans never again. And I'm at the point where I'm like, okay, I get it,
Mhm.
but the point of the federal government is for them to both work together and pass legislation to help everybody. It's not a single, dictatorship on one side or the other. Like that's not how this is supposed to work.
Mhm.
Right. And,
It's
bipartisan.
my how it looks now, but no.
Right. And, and it's, the Republican Party has drifted so far away from who they were 20 years ago, but they will come back to the center if they lose while they're over here. And that's what I tell Republicans in South Carolina. I'm not asking you to leave your party. I'm not asking you to become a Democrat. I'm asking you to self-correct your party by voting for a Democrat once. And as soon as they lose on this far right, then they're going to pivot back to the center because they want to win. They want to be in power, but we have to punish them electorally for them to learn their lesson. It's like parenting 101. If we keep enabling them, they're going to keep doing the
Mhm.
bad behavior.
Mhm.
And then we
Mhm.
can get back to a time where we, disagree on maybe 80% of the things, but we can work together on 20% of the things and move the ball forward for the American people.
Yeah. And we're already seeing it. We're already kind of watching the America First crowd come in,
Yes.
and those are the
Mhm.
ones that are going to start pushing Republicans back into the center,
Yes.
saying we didn't want this war in Iran. We don't want to be overseas. We've said that multiple times. And because Lindsey Graham is part of I love that the Iran war, I love it. He is going to be part of the problem come November. People in South Carolina are going to have to choose America First, and America First is actually going to be you.
That's right. That's right. And we're gonna have new bumper stickers that say exactly that because we cannot let them hijack patriotism, the American flag, America first, South Carolina first. Like
Mhm.
my campaign is America first. My
Mhm.
campaign is South Carolina first. My campaign is patriotic.
Yeah.
And Lindsey Graham's is not. And I think you're exactly right. And I think, 20 years from now, when people are looking back on this specific election cycle and, what happened and how Lindsey Graham lost his job to a pediatrician, it's gonna be this conversation about how he lost, his eye is off the ball. What he's doing is not America first. And so the Tucker Carlsons of the world are very unhappy with him. And there are a lot of Republicans in South Carolina who love Donald Trump and hate Lindsey Graham. And I believe that many of them will either stay home if Lindsey Graham is the Republican nominee, or they will vote for me out of spite towards Lindsey Graham. And I'll take it.
Yes, of course.
What throws me so hard though is I remember the first time Trump was running, and I remember watching the TV, and Lindsey Graham was like, if Donald Trump runs, he's going to destroy the Republican Party. And now I'm like, is this why you're drunk in public all the time? Because like you're coping, like it's a wrap. Like, okay.
Yeah. Yes. And I say this and I mean it. If Lindsey Graham today was that Lindsey Graham who was still like speaking truth to power to Donald Trump or working across the aisle, I would not be in this race. I would be back in my comfortable life of being a pediatrician.
It's not the same person.
It's not the same person.
Not even close.
No.
It's like he wants you to win. It's almost like he's like, how do I help?
He's not even trying. He's going full send warmonger.
Yeah. Well, we'll take it.
Unbelievable.
I'll take it.
Unbelievable. Okay, so when you do win, what are your top 3 priorities?
It's like, I don't want to be a politician and talk for 20 minutes to answer that question. It's really like, it's fixing the broken healthcare system, which is like, a 20-point plan. And then it's addressing the cost of living emergency, which is also a very long plan. And then it's rooting out the corruption. And as we talked about, the corruption is fueling these other 2 problems, but we can do multiple things at once, especially working parents. We can do multiple things at once. And that is what I plan to do. I look forward to being front and center in any conversation about fixing our broken healthcare system, in any conversation about impeaching and removing RFK Jr. I know we need a voice like mine in the U.S. Senate when these conversations are being had. And I cannot wait to be a leader in those conversations. But we also need to just like fix the problems that everyday Americans are waking up and worrying about, like their utility bill and their grocery bill and their gas bill.
And on the topic of healthcare, I also think people are starting to not spiral, but people want it all now. They want the magic on day 1 to be waived, and they want universal health care January 2nd.
Do it.
On the dot. So while I know you don't want to go into the 20-step plan, where do you think it even starts? Like plan like point A through B through C of like where we even start, because it obviously cannot get changed overnight.
Well, I appreciate your framing of this question, because I do grow frustrated when, we use these litmus tests, especially in like the social media world, these litmus tests of why isn't Dr. Andrews talking about Medicare for all? Like, because I'm pragmatic and because of exactly what you said, we've had, a century of a profit-motivated healthcare system in this country, and we cannot shift to a true patient-centered healthcare system, which would be something akin to Medicare for all. We can't do that in one election cycle. We can't do that overnight. And when we talk about that and that only, we alienate people who would consider voting for us and allowing us to move the ball down the field. And there's a lot of pragmatic steps we can take to get us from where we are to where we need to be. One of the first things would be a public option, which, as you know, Obama and the Democrats tried desperately to include in the Affordable Care Act, but Joe Manchin and the Republicans blocked it. If we had a public option, which I do believe there is a political appetite for that now, if we had a public option, more Americans would select this publicly funded, not publicly funded, but, public health insurance plan. And as more Americans selected that plan, realized that plan works better than the private insurance they were buying through their employer or on the Affordable Care Act exchange, they would realize this works better. And so every year, more Americans would choose this. It would slowly reduce the influence private insurance companies have over our healthcare system, reducing their power. And then eventually we could have a very serious bipartisan conversation about a publicly funded healthcare system in this country. But we're not there yet. I'm not going to get to Washington, D.C. in January 2027 and convince enough people that this is where we need to go. So we need to take steps to get there, period.
Thank you.
We can do that because the Republicans' attack on healthcare has been so egregious. It's creating an opening for us to have these conversations about where we need to go. Public option, or lower the age of Medicare eligibility, or what if we started a federal healthcare program like Medicare, but for kids, call it Medikids, and fund healthcare for every American under the age of 18, because that costs pennies on the dollar compared to adult healthcare. If we invest in children's healthcare, they will be healthier when they're in the workforce, and then they will be healthier when they're ultimately on the Medicare program. It just makes economic sense.
Yes.
Ooh, I'm ready to watch you on C-SPAN now. Okay.
Yeah.
Let's go.
Let's do it.
Well, like, because so many people are like, I want this day one, I want this day one. And while it's a great thought to have, I'm like, do you guys realize that if there was a universal healthcare and a system that's already broken, clinics shut down, healthcare providers leaving the field, do you think that would work? There would not be enough healthcare workers to sustain that. Everybody
Right.
would want to make appointments. Everybody would want to be seen. Hospitals could not take on
Right.
that. Like, nobody's thinking in that sense. And so that's why I ask anyone who's running on healthcare being a priority is like, we all know that cannot be fixed overnight, and wanted to explain why it can't. And so thank you for explaining why you cannot get universal health care on January 2nd.
Mhm. Well, glad we
Because
had that
it's
conversation.
slogans.
Right. Like we need
It's
to campaign,
slogans.
but the litmus test thing drives me crazy because
Mhm.
it's not as serious. We need to elevate the
Same.
level of the conversation. We need to get real practical about where we are as a country and
No.
move
Yes.
on. What's that?
Yes.
People don't know what it is.
No, they don't. They don't.
Because we're like, okay, like, and then I hate to sound like the guy, like, how are we going to pay for this? But it's like, okay, Medicare for all. Okay, you said that. Okay, how? Money out of politics. Okay, how?
Yeah. Yeah.
Yep.
Like, yes, we should stop taking the money from the corporations and the foreign lobbies and yada, yada, yada. But also at the same time, campaigns aren't free.
Right. That's right.
Whoa.
Yep. There's just so many moving parts. People just realized what a reconciliation bill is and why
Yeah.
we can't just why we can't just create money, and why they have to move money from one thing to another. So there's so much learning happening that
Mhm.
people just truly don't understand. And that's kind of where social media hasn't been helpful in education. It's been
Right.
helpful in outcry.
Yeah.
So
Yeah. Dividing us, eating our own,
Mhm.
candidates know what they need to win where they're running. No one knows better than the candidate
Yep.
running in some congressional district or some state Senate race. No one knows better than that person what needs to be done to run and what's politically viable where they're running. It doesn't mean candidates abandon their principles or their morals. It just means we become really pragmatic about what we need to do. I cannot help anybody. I cannot help people who are shot in South Carolina. I cannot help trans kids in South Carolina. I cannot help people who can't find an OBGYN in South Carolina if I don't get elected. My job is to get elected, and then I can elevate and expedite and advance these conversations in Washington, D.C.,
Yes.
period. I am no good to anybody if I don't get elected.
That's why we say vote and hold accountable after the fact. Like,
Yeah, they're not going to walk in perfect. That's so.
No
Don't get me
litmus
started.
test.
Don't get me started.
Yeah.
Oh, well, before we get attacked, you said weed out the corruption, impeachment.
You asking me about impeachment?
Yes.
So here's actually where I am on this. First of
Okay.
all, RFK Jr. flag
RFK.
carrying member of impeach and remove RFK Jr. because I think that if we impeach him, he actually will go away.
Mhm.
I don't think an
Mhm.
impeachment of Donald Trump in the year 2027 is going to do anything. I think Donald Trump needs to go off to an island and not be our problem. But I don't think I am serving my constituents as a South Carolina senator by spending my time impeaching Donald Trump again. Period.
Okay.
I mean, at the end of
That's
the
where I am on
day,
that.
if there's a blue sweep, there is really
Yeah.
nothing he can do anymore. He would be a
A lame
lame
duck.
duck
It
president.
would be way more powerful than how many times has he been impeached? It would be way more powerful than another impeachment for us to just take his power away electorally.
Mhm.
And I'm not going to
Mhm.
vote no on impeaching Donald Trump, but I'm not going to get to Washington, D.C. and spend my time working to impeach Donald Trump. I'm going to spend my time working to get more OBGYNs and mental health care professionals working in South Carolina and fixing the bridges that are crumbling in my state.
That's called pragmatic people
Yes.
and walking and chewing gum at the
Yes.
same time.
Yes.
Hey, and it might be fun to watch him squirm for the rest of the time he's in office, because
That's right.
nothing will get done. If we have a majority in the House and in the Senate, he will not be able to accomplish anything.
No,
Any
Yep.
I'll just
it
be
will be
there.
over for him.
I just had to do a video on how Hakeem Jeffries said that, that's not his priority. And I'm like, guys. He did not say, I'm not going to impeach him if it comes across my desk.
Right.
I'm gonna try to fix your life.
Right. See, we get caught up in these things. It's another litmus test. It's, where is she on this? I agree with what Jeffrey said there, that like, it should not be your priority when your constituents cannot keep their lights on. Impeaching the president who's already been impeached multiple times and got reelected should not be your priority. That would be irresponsible governing. And here I am like defending Hakeem Jeffries.
Yes, right.
Right? I'm like, stop making me defend him. I don't want to do this. Don't make me do this.
Here we are. We have to. And I do like that you point out you can't do anything until you get elected. So we are asking everyone who comes on this question. Obviously, after the most recent presidential election, a lot of people think that the system's corrupt. They don't want to vote. They don't want to participate. So what would you say to a constituent that doesn't feel like their vote matters anymore?
They want you to think your vote doesn't matter. If your vote didn't matter, they wouldn't be rolling back the Voting Rights Act. They wouldn't be pushing forward the SAVE Act. Our biggest piece of power and self-efficacy, all of it is in our vote. People fought and died for our right to vote, and your vote matters. Local elections sometimes come down to the single digits. And everything we do in this moment matters. And I think about this all the time when I'm like, my life is so hard right now. I'm never in my own bed. I'm never at the soccer field. I was tonight, but I'm never watching my kids play their sports. I'm giving up so much, but everything we do in this moment matters. I cannot imagine 10 years from now telling my child or my future grandchild, oh, I didn't vote because my vote doesn't matter.
Yeah.
This is their democracy. This is their planet's health. This is their future, and every vote matters. And you've just got to believe that, because they want you to not believe it. But I always think about the people who fought and died for our right to vote, and the people who are trying to silence my vote as a woman, and the people who are trying to silence Black South Carolinians' votes. And, we've just got to show up in record numbers. The votes are there, particularly in my election. Jamie Harrison only lost by 10 points. 1.1 million people voted for him against Lindsey Graham in 2020. If 1.1 million South Carolinians show up and vote for me in a midterm election year, they will call this election in my favor the moment the polls close. And that would be a cathartic moment for not only South Carolina, but the entire country, and frankly, now the entire world, who see Lindsey Graham as a cancer on this country and an enabler, the greatest enabler of the Donald Trump agenda.
Mm-hmm. I truly believe there's going to be certain elections in November on that night that people are going to be watching like a hawk for hope. And that is going to be one of them. That is going to be one. People that don't even live in South Carolina, all eyes are going to be on that election.
No pressure.
No pressure. But it's just like, because
it's just everyone's watching.
Everyone's watching, because he's like, it's one of those that is a Trump talking head. That is somebody that has given their loyalty no matter what, that has changed who they are. And if somebody can defeat the most loyal to the MAGA party, then we have a shot. So those are going to be some of those races. This one is going to be one that people absolutely are going to be watching like a hawk.
Yeah. I look forward to it. I look forward to shocking the country. I do. I really do, because every day I'm out on the trail and in these communities in my state, I feel more and more hopeful. I feel like it can happen. People want it to happen. It can happen. And it will be, what I say is South Carolina will be central to this narrative about how we turned the page and started the next chapter in American democracy. South Carolina can be a huge part of that story if we do the work between now and November 3rd to get out the vote and to defeat Lindsey Graham.
I'm sold. Okay. All right. So actually, I'm very sold. So I want to know, if you're running for president, who's your dream VP, living or dead?
Oh my gosh. I thought about this, not running for president, but like the adorable on brand answer would be, like my 9-year-old daughter, because she's smarter than me and braver than me and all of those things. She's already an elected person. She's a councilwoman on her student council.
It's meant to be.
Starting early.
That's right. She's the only person in my family who's ever won an election, but that'll change in 6 months. But I think my serious answer is, we are in desperate need of people who know how to win seemingly insurmountable battles and fights. And when I think about who that is in history, it's people like Martin Luther King Jr. or people like John Lewis. And I think we need a fighter from the civil rights era. And so you said living or dead. So I would choose either one of those two gentlemen to be on the ticket with me. I don't have an ego big enough to say I should be on the top of that ticket, but that's how you framed the question.
Sold. I knew I'd love the answer. I'm sold.
Right?
I'm going to go commit voter fraud for you. All right, let's do this.
That's fun.
Right? I know. I'm like, oh, I want to be in South Carolina, but I have to be here in Florida voting. I have to.
Oh, yeah. They need your vote in Florida.
Be here.
Mhm.
But next place I'd go to and sign myself up and live there and vote would be
I
South
love it.
Carolina. This is a fun one. You obviously don't have time to go out for a night on the town. You're very busy. But if you had to, who would you rather go out for a night on the town, hopping around the bars, Lindsey Graham or Ted Cruz? A night on the
Yes.
town.
Well, from a pragmatic standpoint, if I could bring my smartphone, I would love to accompany Lindsey Graham to some bars because I think I could probably win the election. I was able to do that. I also think, like all things considered, I bet Lindsey Graham, if he was like living authentically as who he is, he'd probably be a pretty fun hang, like he could be.
Right? I
He
mean,
could be.
He has personality.
he does.
I'll give him that.
Personality.
He does.
He does.
Uses it in the worst way.
That's right.
Yeah.
Like if I have the privilege to end his career and then 18 months later he is interested in going out for a couple beverages, I would take him up on that offer.
Mm-hmm.
Hey,
I have
why
no-
don't you-
Where he's at that point. Because
I have no interest in getting to know Ted Cruz better than I know him now, which is not at all.
yeah. That's true. Yeah, she just needs those smart glasses that videotape everything and then
Right.
she goes.
What was that you said, Lindsay?
Say that again.
Again?
Yeah.
You hate Donald?
Right.
Wow.
Right.
Yep.
That's so crazy.
Perfect answer.
Tell me more.
All right. So, in our minds, when everybody wins, we're going to do a national tour. So, what is your hidden gem that you would show to us when we go to South Carolina?
Okay. It's a beach called Botany Bay, and it's on Edisto Island. So it's on the coast. It's not far from where I live here in Charleston. And if you Google Botany Bay after this, you'll see these incredible, it's like at the Skeleton Beach. It's all these old
Mhm.
branches and trees. And it's just like the most beautiful, beautiful, untouched because it's, you're not allowed to take any shells from the beach. It's beautiful and peaceful, and it reminds me of the beauty of South Carolina and why so many people choose to live here. And it's really just sort of it's not a tourist trap. It's never crowded. You got to look at the tides because you want to go at low tide, so there's more places to walk around. It's amazing. Botany Bay.
Okay. So we're
Hell
going to
yeah.
reconnect with nature for a bit. We're going to be instead
Hell
of
yeah.
touching grass, we need to go touch.
I was going to say, we're touching.
Go touch some sand on Botany Bay, and yes,
Said you guys got to get off the internet and come touch sand.
social media cleanse for a minute and just go sit. by the
Stop teaching civics on the internet and go touch sand for a little
It
bit.
will feel very hopeful after you win and there's a blue sweep to just go stand by the beach and have hope for once. So, you know what?
Oh my
It
God.
seems picturesque to me. I'm down.
Yeah.
yes,
Yes.
Yeah.
Hope. Remember that.
yeah,
Yes.
It's coming.
Yes.
it's coming back.
Well, Dr. Annie, before we end, we want to give you a chance to plug your website, your socials, where people can donate, and if you have any in-person events where people in South Carolina could come and meet you in person.
Yes. Yes. So follow along, drannieandrews.com. Lots of information there, including links to all my socials, which I'm very active on social media. Instagram is like my primary, but we're posting everywhere. On Instagram, I'm at Annie Andrews MD. On the website, drannieandrews.com, you can sign up to volunteer. You can volunteer from anywhere. You can text bank, phone bank from anywhere. You can see where we're going to be. There's an events tab there. You can see locally where I'm going to be. We're doing a college tour. We're all over the state. We use Mobilize, so you can sign up RSVP to our local events there. And, Lindsey Graham impacts all of us, no matter where you live. And we have a real opportunity to unseat a 23-year, deeply entrenched Washington, D.C. Republican warmonger swamp creature. And it takes everybody. I don't take corporate PAC money. Your $5 a month donation helps. That's what fuels this campaign. Our average donation is $29. So chip in what you can, be a part of this movement so that on election night, when you hear the news anchor say, or you probably, nobody listening to this actually watches the news.
AP News.
When you're scrolling on social media, sorry, I just totally dated myself. Jesus. When you're scrolling on social media and you see that they called this election, and instead of Lindsey Graham's face, you see my pretty face pop up on your social media profile or your social media feed, I want you to be able to say that you were aware that this was happening and you also helped to make it happen. So chip in $5, chip in $500, whatever you can, and let's unseat Lindsey Graham, turn the page on American democracy.
Yeah, because I don't know about you, but I can't wait to hear Aaron Parnas break the news that you won.
Oh, that's a good one. That's what I should say.
Yeah, that's where everyone.
I'll fall to my knees.
Yeah, but most of all, when is the primary? Let them know when the primary is.
Yeah, so voters in South Carolina, our primary is June 9th. I need people to get out and vote for me in the primary. I'm really proud to have Jamie Harrison's endorsement in this race. I'm really proud that we've raised $7 million already, far outraising anybody else that's going to be on the ballot. I am running a serious campaign. I've been everywhere and anywhere, but I do need people to show up and vote. And what we need here in South Carolina need on June 10th, the day after the primary, is for the news to be, oh my God, look at how many people showed up and voted in the Democratic primary compared to the Republican primary. Look at this Democratic voter enthusiasm, because that will scare Lindsey Graham. That will put them on the defensive. So that's what we need to do, channel all of our energy into getting out the vote here in South Carolina on June 9th. And then come June 10th, when I am the Democratic nominee, we'll be laser focused on the general election and ending Lindsey Graham's career.
Yes, that's exactly the type of energy we need. Vote early, vote always.
Yes.
That's how it has to be from now on. We cannot go back. Early and always, till the day you die. That is how it has to be now. So yeah, we want to see those exit polls. We want to see just a turnout that has not only Lindsey Graham, but MAGA politicians everywhere sweating profusely.
Yes.
That is the name of the game. And so South Carolina, check your voter registration. If you show up and there is an issue, because they are going to pull shenanigans, we can't stop the shenanigans. They're going to happen. So just make sure, no matter what, that you do not leave without casting a vote, even if it's a provisional ballot. Do not leave. You have a right.
Don't leave.
That's right.
So do not let them turn you away. They're going to try. Don't let them. You know your rights. Call the news stations. Call Dr. Andrews' team. She'll be there.
Call everybody.
She'll make sure you vote.
Right. That's right.
Shoot up a flare.
Yes. Yep. Yep. It's just, it is what it is. And in South Carolina, I feel like they might try some stuff. So everybody be alert, vote early, and we cannot wait to see the light on June 10th come rising in and your name and headlines everywhere. And
can't wait.
We thank you so much, because we know you are very, very busy. So thank you so much for coming on. And next time you're on, we hope that it's up at Capitol Hill, that we get to see you in person.
Yeah, let's do it. Let's do it. You can come to my Senate office.
Yes, let's go. Thank you, Dr. Annie.
Thank you so much for having me. I really enjoyed the conversation.
Thank you so much for being on. And everyone, make sure you tune in next week and every other Thursday for Chat GRC. Grassroots candidates, no corporate, no large PACs. These are grassroots candidates. They need your money. Don't buy a nice coffee. Donate to your local grassroots candidate. We will see you next week. Thank you. And thank you, Dr. Annie.
Thank you.
Bye.
Bye.
Bye.